Hello everyone, I am Dr. Ameya Joshi. I am an endocrinologist and diabetologist practicing in the city of Mumbai. I wish that on this World Diabetes Day, let us work together to make India diabetes free, or at least diabetes complication free. We all know that we are stuck by this pandemic of a chronic disease called as diabetes. Diabetes essentially means an increase in the blood glucose level. That means your body is unable to use glucose and this glucose level in the blood rises. Diabetes can affect everyone. It affects children, adults and elderly. The chances of getting diabetes increase with age, but even children are not spared because diabetes is of multiple types. Type 1 diabetes is a diabetes that mainly occurs in children and rarely in adults. This occurs because the insulin producing cells are destroyed and so there is no insulin. The treatment essentially is taking insulin. Type 2 diabetes occurs because insulin cannot act properly. The end result is again rise in the glucose levels. However, this occurs mainly in adults and elderly. Type 2 diabetes can be managed by lifestyle modification and to an extent by medication, and a good number eventually need insulin. Diabetes manifests by increased thirst, increased passing of urine, increased appetite, sometimes infections that do not heal, sometimes there is tiredness, fatigue, lethargy and body pains. However, half of the people with diabetes are actually asymptomatic, and so it is important that we get tested proactively. Anybody above 40 years of age, anybody above 20 years of age who is overweight, obese or has a family member with diabetes should come ahead, get tested on an annual basis, and if found to be diabetic, try for diabetes reversal or control diabetes properly, which can easily be done. It can easily be done most importantly by accepting the problem, acknowledging that you need help, seeking advice for a proper disciplined diet, exercising on a regular basis, taking your medications properly and being regular with the medical consultations. Remember that we cannot walk on a road with our eyes closed. Similarly, we cannot manage diabetes without measuring it on a regular basis. And so it's important that diabetics measure their glucose level as well as check for complications on a regular basis, get it assessed, detected and treated as the need be. I am sure if we do this, we can prevent most of the diabetes complications and reduce the burden on our already overburdened healthcare system. Thank you.
अहो लग्नाची तयारी ताबडतोब सुरू करा.
कारण मराठीशादी.com च्या मॅच